Yeah, because I know it's like with all of us, the patients who are in the community of instability, we hear of doctors like Hutcheson, Dr. Katz, Dr. Rosa, but we also hear of those other horror stories, so to speak, because there's just that lack of training. And this is why I'm really glad that Dr. Hutcheson, you're now doing virtual consults.
Yes.
The question I have, because I guarantee a lot of those who are in the United Kingdom don't know who to go to because there's no digital motion x-ray there, and it can be very hard to get care. So one of the questions I had, if you're doing virtual, what could they do with standard x-ray, what you would need to help maybe come to at least a sort of a diagnosis that there is either instability or lack of curve or even just an answer for their symptoms?
Yeah, that's a great question, and I've done a couple of consultations or tried to guide people in the UK, and they've gotten MRIs, they've gotten flexion extension x-rays, they've gone to Spain and seen a neurosurgeon there and gotten more imaging as well. Dr. Gillette will do cone beams with rotations, certain kind of MRIs and stress viewed. So there are areas in Europe where you can get enough diagnostics done where we can get you started. It depends on the severity of your case if you'll need to travel to see a doctor in the States. But the question we had before that, when we were talking about adjusting and different chiropractic approaches, was that I wanted to add in that often people that go to a chiropractor and then they say they feel worse after, that they, in my belief and in my experience, is it why did they go to the chiropractor in the first place? Because this is what people don't consider when they, there's been other doctors that have said, oh, well, every time you get a, manual adjustment, you're causing an injury. And that's absolutely not true. Manual adjustments can be very healthy and helpful. But what happens is, Robert, somebody went into the chiropractor and they had a problem, right? Yeah. They very rarely were they like swindled into a way to go. I mean, in every trade, there's one outlier that, is inhonorable. But usually they went to the chiropractor because they either couldn't turn their neck, they had headaches, they had some problem. And what the chiropractor did was freed up that spot that was trying to fuse itself because there was underlying instability already. Mm-hmm. Now they got it moving, and now you're getting, vagus nerve interference, you're getting jugular veins getting hit, you're getting spinal cord compressions, CSF problems, because now the motion is there. And they'll say, well, I never felt this bad before. Yes, because your body was very carefully, we have this innate ability for our body to find the way to create, a defense system. So it was creating that defense system, but you still felt terrible, and it was only going to get worse. So now that you actually got that adjustment, there was a bigger problem under there. So do I recommend that almost everybody should get a minimal view DMX before getting, big power for upper cervical adjustments? Yes, I do. However, I just want you to know it's usually not the chiropractor that did the damage. The damage was there. They got the mobility, and now you're getting the neurologic symptoms.
That makes a lot of sense, because the patient I was talking to yesterday had his first treatment with an Atlas orthogonal, and his systemic went offline. Everything he was walking heavy, feeling a little bit pressured, feeling dizzy, feeling off balance, and it was a very scary sensation. Now, my understanding is that the brain gets used to subluxation, it gets used to the imbalance that they had for all these years, and then suddenly when you put them back in alignment, the brain's like, this is not my normal. Yeah. I like the abnormal normal. Yep. And therefore
that's a great question. And my answer to that question is that it's not always the Atlas alone that needs to be adjusted. So you may have set the Atlas in perfect alignment, but they may have an occiput that is shifted posterior on that Atlas. Yeah. They may have C2 malrotation that didn't get fully unlocked when you adjusted the Atlas. They could have a problem lower in the neck. So if the Atlas got lined up just right, but the skull is still in the wrong place, and it's barely, it could be something that doesn't show up on a vertex view or on an upper cervical adjustment, or they could have, the muscles are completely atrophied and dead. So when you set that bone in place, but the bones were kind of resting in a way that was a defensive barrier, and now the bone is allowing more motion because you set it in place to create better motion, to have integrity. So another problem could show. So we have to be thinking about rehabilitating the longus capitis, the longus coli, the posterior spinal musculature, to make sure the curve is right. If the head is too far forward, Robert, and you set C1 in perfect alignment, you're still usually going to feel pretty bad when you have one of these more complicated conditions. And so you have to get the head back over the body, and then we usually work more on setting precisely C0, C1, C2. But if you're here, think about you have a 10-pound head on a 2-ounce atlas, and so you set the atlas in alignment. How is that going to, in these hard cases, how is that going to be the final solution? Unless you get everything here, and then you can do the fine-tuning.
Makes a lot of sense. I was about to cut you off. I wanted to let you finish.
Go ahead, yeah.
Because one of the cases I actually saw, Dr. Jeffrey Middleton, who was also atlas orthogonal. At least, in one of his videos, he showed, even though he can get C1 straight, the person had a calcific facet joint that would not unlock and would not move. So then how could he go any further? You can reset C1 all you want to. So it's a very important thing. It is true. We have to look at the whole entire cervical spine. Now, is it just cervical spine only, or do you have to see other areas?
Yeah, you have to take it case by case. There have been individuals where I've had to correct the lumbar lordosis in order to correct the neck problem.
Wow.
Because there's spinal cord tension, right? If there's more than a 10% stretch on your spinal cord, it starts to undergo plastic deformation. And if there's over, I think it's 15 or 18%, it's seriously causing abnormal signaling in the entire spinal cord. So if your lumbar spine has a horrible curve and you have scoliosis and you're only working on the upper neck, that's a good place to start, but you may have a lot of limitations if you're not addressing the whole spine.
Wow.
So, yeah.